So here, nursing process, I think of day-to-day life as a nurse. In nursing school, again, it wasn't something that I really put a lot of thought into. Again, I thought it was something that was clinical paperwork. But now as a professional nurse, especially working as a float team nurse, I use it every single day with every single patient. So being float, I go everywhere. I work in our emergency department, I work in our neonatal intensive care unit, I work on our medical surgical floors, I also work in sedation and procedural services. And so when I step in just for 4 hours, I have to do my assessment, diagnosis, and planning pretty rapidly. When I'm doing that, I don't necessarily think I'm using the nursing process, but then when I sit back and take a look at it, then I go, oh yeah, I've been using the nursing process through everything that I do. So one of the examples that comes to mind with using the nursing process in practice was one of my more difficult shifts in the emergency department. Had this little girl that came in and was working really hard to breathe. And we didn't really know what was going on. And at first we thought she was just more irritable, more of a typical bratty 2-year-old, as we would call them, and parents were younger, and we made some snap judgments. But as things progressed, we started realizing something was seriously wrong, and working with our doctors to come up with a plan and then a diagnostic criteria, and we ended up sending her to the ICU. But it was my observations of what my assessment findings were that really helped guide that plan of care. And so just being mindful of the nursing process would help me communicate that to the physicians to help us get to the diagnosis quicker. So just like my first example of talking about using the nursing process in the ED, a lot of times it's hard to use the nursing process in the emergency department, especially when kids come in really sick and we got to move really, really fast. You really don't have time to do all the different components. You kind of recognize something and you move. There is no diagnosis or planning. We're just seeing and we're implementing. And so that process can be sometimes a little harder. You lose your train of thought as a nurse and what your end goal is because you're working on just stabilization. But then once you've had the patient stabilized, that's when you can go back into the nursing process.
Nursing process, when I first read the question, I immediately was like, oh man, nursing process, I don't really use that. Do I use that? And the more I thought about it, I realized it's very much so an everyday thing. It's something that I use constantly and I don't even realize it. During school, it was kind of like this linear process when we were writing our care plans. It was like, what is assessment, what's planning, going from here to there. But throughout the day, on the ICU especially, it's just this ongoing assessment and it's not always linear. And it's something that's very natural for me. It was kind of comforting that I do use it. Being in the ICU, there's like kind of two different parts of the nursing process I like to think about. There's like the actual nursing process of the things that are happening in the patient's room, kind of the hypothetical as well. Because whenever ICU, everyone says ICU nurses are super pessimistic because we think of the worst thing possible. But we need to, because we need to see if things are going to go wrong, what are we going to do? And so, for example, in this one patient's situation, they had been recovering from just respiratory stuff. And the hypothetical was, thinking what can go wrong here, but then the actual is the respiratory issues. So this is kind of an extreme example, but we were just kind of dealing with all of this respiratory stuff and, implementing plans to help her better with her respiratory issues, like getting up and moving around, having her drink some water, having physical therapy come see her, and just kind of get the secretions moving around and so she can get it out and you evaluate that, how her oxygenation's doing. But I also heard her bowel sounds were just kind of goofy throughout the day, and she had also had some mental health disorders and she couldn't really speak too much. So being an advocate, trying to see what's going on with her and assessing her, even though she couldn't tell me, and that's a lot of people up in the ICU, they're very critically ill, so you have to use assessment a lot because they can't always speak for themselves. And so she was still having some loose stools, and I was like, okay, things are still moving. But then halfway throughout the shift, she just started getting really agitated and complaining of pain, and you couldn't really figure out what was going on, gave her pain meds, and eventually she didn't have any bowel sounds. And so a big part of planning and implementing is also calling the doctor and informing them of some changes. Long story short, through all this process, we had to send her to CT, and she actually had a developing bowel volvulus, so the twisting of intestines, and to be sent to surgery right away. And so it was, going into it, I'm not expecting her to get this, but it just shows how it's ever changing. At the beginning of my shift, I'm thinking, oh, this woman's getting better, she's probably going to be transferred, and then by the end of the shift, it was a completely different body system, and she had to stay there a lot longer. And so it just is a lot of evaluation and kind of going with the whole process there. It was a lot. It is hard to use the nursing process in the ICU because there's just so much stuff happening that you don't always have time to think and plan everything accordingly, and it never goes the way you want it to go because people, I mean, it's every body system that they're sick with. I had one person come up that it was just a train wreck. When he got up there, he had liver issues. I mean, every system was just failing him. And he came up with about 2 IVs running into him, and within an hour, I had 17 IVs running into him. I had about 5 nurses helping me. I had 3 doctors up there at bedside, and it was just the chaos is the way to describe it. And, you know, we had to see what his labs were and what this was and kind of implement all of these different things. But really, when you're so distracted like that, you sometimes forget to just look at the patient and assess, is all of these 17 IVs going to this person actually helping? Do we need to get an x-ray? Do we need this? And so I can't do that alone, even though we want to be the superheroes here. Having all those people in the room to help out was really helpful, but it makes it really challenging when you don't know everything and you can't know everything, and when there's just so much chaos happening, to try to stay focused, I guess, and be there for the patient. You still use the nursing process through that, but it's all jumbled, and it's nice to have other people helping out through that.
So as a nurse midwife, I see the nursing process much differently now than I did probably in the beginning of my nursing career. I remember having to do countless care plans as a nursing student, and when I did them, they were painful, in all honesty. I had the opportunity to teach nursing students for a few years, and I remember watching them go through that process and remembering what it was like as a student. But I honestly think now, having been a nurse and a nurse midwife for over 25 years, that the nursing process actually teaches our students and teaches us how to be thinking critically and thinking about the process in more of a circular sort of pattern. And so nurses start off with assessing, and then they make a diagnosis, and then they make a plan, and then they implement and they evaluate, and they go right back to assessing again. And so it really is a circular process that helps us critically think. I think an example that I have now as a nurse midwife, as a provider, is you might have a mom who comes in and appears to be in an active labor pattern, and baby looks great, and so you've made your assessment that things are well, and your plan is to continue to monitor and evaluate and implement just different strategies to help support her through labor. And then you're going to evaluate her maybe an hour later and find out that maybe there's not a lot of progress in labor, but baby still looks great. And then you decide, what's my plan? Is my plan to continue to watch, or is my plan to maybe do some strategies and different interventions to maybe make labor go a little faster? So maybe I'm adding Pitocin at this point, or maybe I'm having her get up and walk around, maybe get in the water, those types of things. And then I come back to evaluating it an hour later and seeing how she's doing then. So it really is a continuous circular process, and really none of them can stand alone. So it's an amazing, I think, way to take care of patients and to really encourage nursing students to critically think as they care for patients. So as a nurse midwife, I see the nursing process much differently now than I did probably in the beginning of my nursing career. I remember having to do countless care plans as a nursing student, and when I did them, they were painful, in all honesty. I had the opportunity to teach nursing students for a few years, and I remember watching them go through that process and remembering what it was like as a student.
When I hear the word nursing process, it just sounds like what it means to be a nurse. It is part of nursing. You cannot separate nursing from nursing process. It allows us to use our critical thinking skills. As a nursing supervisor or as an admin manager, you're always receiving information from different departments, and you have to decide on what to do with the information and how to support the various departments. Sometimes you don't even realize that you've done the assessment or you've planned and you've implemented, but they all come together because it's like a wheel that is just spinning in one's brain. So, for instance, if I have two departments that need nurses, but I only have one nurse to give them, what I do, I listen to both departments. They tell me why they need the nurse and if there's anything that they can do if they do not have that nurse. Listening to them, I'm able to assess the situation and then decide which department takes the nurse. So when you think about it, I already assessed. I planned on how I was going to execute by giving them the nurse. And then I gave them the nurse, and then went back to evaluate the situation. The most difficult time to use the nursing process is when you've involved everybody else, especially when it comes to codes. Assume we had a code green. Code green in our hospital is when we have a violent individual. When you think about that, you have the individual who is violent, you have the department you're involving is security, you're involving the nurses and the leadership in that area. Sometimes it's hard to plan in the moment. It's okay to plan when you have time to absorb all the information and then act. But when you have to act immediately, you find yourself implementing and then realizing, oh yeah, I actually assessed, but did not necessarily take time to assess. I had to implement it fast. When you look at the cycle, you see like you did not use everything in the cycle, especially when in an emergency.